we're back on the Unapologetic Podcast. My name is Brandt Merritt.
I'm Jonathon Woodyard.
And we are today on our Springfield campus, which is the SBU Mercy College of Health Professions is where it's housed. And we're joined by two special guests on this episode. Cindy, you want to start? Introduce yourself and then Renee.
Yeah, I'm Dr. Cindy Todd. I am the Division Head for Health Sciences and Post-Licensure Nursing.
And I'm Dr. Renee McCarley. I'm the Division Head for Pre-Licensure Nursing. And we have 3 different campuses. We have Salem, Bolivar, and Springfield. And so we have ASN and BSN.
So we don't do anything at Mountain View?
We do not have a program at Mountain View at this time.
Okay.
Yeah, we have approximately around 250 students in between all the nursing programs.
Awesome.
Well, that's kind of why we wanted to do this with you guys, because, as we talk through different areas of the university, the nursing health sciences is just a huge and growing part of all that we're doing at SBU. So we wanted to spend some time with you all, talk through what it means to teach that subject from our worldview and just the amazing experience that you all have. But we always like to do an icebreaker. So I came up with I thought this was a great one to start with in honor of where we are. And I could maybe be proven wrong, but I was going to ask each of us, what's your favorite medical drama or medical themed movie or anything around those? And you already sort of...
Yeah, House. I love House. My wife and I have watched, I think we've watched all the seasons of House, but I always thought if I went back into medical school, that's the type of stuff I'd like to do, sit around and try to figure things out. It sounds like a lot of fun. And maybe not like him in terms of personality, but yeah, I think that'd be a lot of fun, trying to figure out crazy diseases and things that are going on with people. And I think it'd be a...
So not Doogie Howser.
I never watched that.
I did. I watched it. Yeah.
You did?
Yeah.
Was that your choice? Or
Yeah, I think I was a kid.
You were a kid?
Yeah.
I didn't watch that. So not Doogie Howser, just House.
okay.
Without the drug addiction.
Yeah.
Yes.
Yeah.
Okay, that'd be good. We don't want to promote that.
No,
That's right.
no.
Yeah.
I was going to go with more of an action movie. I was trying to think through. I don't watch the dramas. Never watched the ER or anything else. But the movie Outbreak. Did you ever watch that?
Oh,
Oh,
yeah.
yeah.
Yes.
Dustin Hoffman,
Yes,
Renee
yes.
Russo. It's like an Ebola type outbreak, and it's just.
I mean, I like those type of movies, but I didn't think that along those lines.
So it's not really a medical drama, but medicine's involved. So that's the one.
Medicine's
I
involved. Well, that's any movie.
It's okay.
Yeah.
I've set the rules. So
Okay, I guess so. Yeah, whatever.
What about you all?
Well, Grey's Anatomy came out when I started nursing school in 2005, and it's still going. So,
Isn't it like a soap opera?
It's
Yes.
a lot of drama.
and I
It's like
realized
As the World
really
Turns
quick that it is not at all accurate to the healthcare world. And no, doctors do not put in IVs.
No.
They do not draw blood.
No.
They don't. They don't do half the things that they do on that show.
Yeah.
So it kind of became soap opera, and I just kind of faded out with it. It was kind of good.
And scrubs do not fit like they do on TV. So just so y'all know, the scrubs are
Fair
real
enough.
baggy, but on TV they're just form fitted, and it just is not.
Everyone's makeup is perfect.
Yes.
Of course,
Everyone's
in the
beautiful.
Yes.
In the
Beautiful.
ER where things are going crazy, but everybody's
Yes.
hair's in place.
Yes. Yeah.
Sure.
So
That's real life.
Yeah. So I like Call the Midwife. That's my favorite because of the nurses. It was holistic care, and they were with the nuns, and they would go to the homes. And I truly believe we could use Call the Midwife to teach part of our maternity section here, because some of the problems they were dealing with, we're still, deal with today. So yeah.
My wife is going to kill me that I didn't think of that one.
Oh, I love that.
We watch it's a PBS show.
Yes.
So like if you progress from Downton Abbey to then Whole Dark or All Creatures Great and Small.
Yes.
And then Call the Midwife. Isn't it?
Yeah.
No idea what you're talking about. I knew Downton Abbey and then I lost it.
Yeah.
Yeah.
But they have a ton of real babies in that show.
They
which is
do.
kind of a
Mhm.
crazy,
Yeah.
crazy thing.
But the medical world
Beautiful
is not
stories.
like TV.
Oh no. Yeah. It's very beautiful on TV. It's
Yeah.
It's messy in real life. A
It's
little
real
more
messy.
It's stressful.
Yeah.
I had a student come to my office one time. like when I first got here, and students are dealing with stress, all kinds of stress, right? And then they live in dorms and they're dealing with stress with roommates and different things. And they come like, oh, I need to move off campus because life is so stressful. You know, I've got roommates and they come into my room or people can't be quiet and just too much anxiety in my life. I'm like, okay. And I listen to those. And then I ask that particular person, I'm like, well, what major are you in? And they're nursing. They want to be an ER nurse. And I'm like, there's going to be some stress and anxiety.
Yes.
So maybe this is a great time for you to learn how to deal with the stress of a roommate before you get into the ER. So it's a stressful line of work.
Yeah.
Sure.
Yeah.
Well, and you prepare students for that field. And it's been, one of the interesting things that I just continue to learn through, we've both been here about 2 years, is the history of SBU's work in this field. So starting back in the 80s with St. John's, which now became Mercy. So I don't want to sort of speak for it. I'd love either one of you, if you wanted to kind of talk through some of the history of the program and sort of maybe the major changes over time.
Sure. Well, I'll let you speak to the nursing side of things. And the ASR program, so that's the Associate of Science of Radiography, has been around since the 50s. And they were a hospital-based program that existed here and then transitioned over with SBU officially in 2017 was when it fully went over.
Which hospital was it with?
Mercy.
Oh, it was with Mercy. Oh, okay.
Yep.
Interesting.
And they're exclusively do their clinicals through Mercy and all their affiliated clinics outside of there. Great partnership there. All of their radiologic technologists, they actually serve as clinical preceptors for our students.
Okay.
And they are teaching them with over 1,200 clinical hours in 5 semesters.
Oh, wow.
So,
That's a lot.
yep.
Seems like a
Wow.
lot.
Yeah.
How long have you been here? Maybe either one of you, or both of you. How long have you been at SBU?
I came here in 2014.
2014.
A little bit earlier than that, actually. I was a shared employee between Mercy and SBU for a while. I worked as a clinical instructor for here, and then I also was an educator for the neuro floor at the hospital. And then I fully transitioned to SBU in 2014.
Okay.
And so I've been here since 2007, and I was with our nursing program when we were with Mercy, hospital based, but it was still an associate degree. And and then I transitioned to SBU in 2017 when the nursing program became part of SBU. Yeah. So
I didn't mean to interrupt the history. Of As we're talking about the history, like your all's history here, it's been a long time.
Yeah.
But we both have worked, like I've worked for Mercy. I had started working with them in 96. Like I'd been out of nursing school for 1 year. And I started working with them, and you worked with them for many years.
Yes.
Before coming here too. So.
2006.
Yeah.
Yep.
So the nursing program, again, is with the hospital created it. Oh, it's over 100 years old. And so you can go back in the hallway, and we have some of our original pictures of our classes. And we had male students back then, which is great. And so it was a diploma program for many, many years, which is what most of the nursing programs were. They were they were based in the hospital, and where the students really learned everything at the hospital. And so then we transitioned to an associate degree, and then we transitioned to SBU in 2017. So we expanded our campuses. So we expanded to Salem also in 2017. So we used to just be on Springfield. And then we expanded to our BSN Bolivar program just in 20, was it 19?
I think 19.
19.
Yeah.
And a couple of years after that. So, yeah.
And then as a leadership team, we're kind of unique. We have been together, Dr. Hendrickson, Renee, and I have been together since 2018, which in nursing, academics, and healthcare is very rare.
Very rare.
Yeah. To have a team that sticks together. When we go to conferences for our accrediting bodies, they ask people to raise their hands if they've been in the profession for less than a year, and a large percentage of hands go up.
Yeah.
So
Well, we're incredibly thankful for that longevity
Yeah.
and just the consistency with it too. And Dr. Hendrickson, Dr. Brittany Hendrickson, the dean
Amazing.
Yeah,
of the
fabulous.
college.
I didn't realize we'd been going for 100 years.
Oh,
That's
yeah.
amazing. I mean, obviously not in this building.
Yeah.
And when you go back 100 years ago, where would that have been? Who was that? I mean, what did that look like?
I think it was in the hospital.
Which hospital were we talking
Mercy.
Mercy.
Mhm.
It's always
Which would
been
have
with
St.
Mercy.
John's.
Mhm.
Yeah.
Yeah.
So it was called St. John's back then.
Yes.
That was the
And then they
original.
transitioned to Mercy. Yes.
No.
That's
Yeah.
amazing.
Yeah.
That's cool. And you said when you were talking, you said, and we had male students then, and you kind of laughed. So what was that?
It's just that nursing typically doesn't
Yeah.
have as many male students. We're seeing
Mhm.
more today,
Yeah.
but it's just, I just love that over 100 years ago, we still had some male
Yeah, that's
students
cool.
for nursing. So yeah.
Yeah, and I mean, even going to the hospital or going to the doctor, that seems to be less and less of an anomaly.
Mhm.
Yeah.
I don't know if that's true or not. It's just anecdotal. what I'm
Yes,
seeing.
yes,
Yeah.
yeah.
Well, the fact that it started with St. John's, now Mercy, is a religious
Mhm.
institution.
Yep.
And obviously, we're a Christ-centered university. So that idea of faith in healthcare has been part of these programs since the beginning.
Yes.
But it can, I mean, we know as well as anyone, there are Christian universities that are Christian in name, but the way they teach or the outcomes, maybe it's not embedded in their curriculum. Whereas, I know for us, it is. And so
Yes.
as you all are teaching students and you're trying to not just prepare them to be excellent clinicians, but also faithful believers in the field. What are some of those ways that faith sort of builds into the curriculum?
It starts with our program outcomes. So we have servant leadership for all of our programs, ASN to MSN. So, and then it goes to our faculty. Our faculty are caring, Christ-like faculty that really care about our students. We start our classes with prayer and devotion. And when we're talking about caring for patients, we're talking about seeing them, through body, mind, and spirit. And we encourage our students to pray with their patients. And it's just integrated through everything that we do here.
So even in the hiring process, I would imagine you're interviewing new faculty members, that the conversation about their beliefs, their background, what they believe about Jesus,
Yes.
their faith, their walk with Christ. I mean, I'm assuming that's part of it, right?
Yeah. Because we're unapologetically who we are.
Yeah.
And we're proud of it.
Sure.
But even taking it a step further, our students have to treat the whole person, and they're doing a spiritual assessment, but we also have them try to discover their own spiritual gifts and how they can take what was modeled for them by our Lord and do that for others. The very nature of their profession in healthcare is models what Jesus does.
Yeah. That's good.
So really that's honing in on that and realizing that when you walk into a room, you have no idea what you're walking into, who you're walking into, but everybody in that room is who you're there to take care of. The family members, and then beyond that, nursing and any other ancillary health profession, the community is also a patient. So what we do out in the community, there's, healthcare workers working in incarceration areas. They're working in health clinics, schools. So everything that we're modeling and what we're doing to give back to the community is embedded in them from the very first fundamentals class that they take in their respective programs. And that is over and over that holistic look at the whole human being and what do they need. And then what are you able to give them in a secular or non-secular environment?
Yeah, because that becomes pretty stark, I guess, if you're serving as a nurse in Mercy versus, and I don't know Cox super well, but
Right.
not a faith-based institution. So as you work with students to kind of prepare them for that, I mean, how difficult is it? Is it easy to kind of help them know how to walk the right line, or has it become maybe trickier in recent years?
Now, I actually think that people have the discernment to know that they can be praying for someone and for that patient without crossing a boundary that may offend someone or may cross the boundaries of the policies of wherever that they work at.
Right.
I think that people have that discernment. And we also have a code of ethics
Yes.
in nursing. And that code of ethics is always that, to take care of the patient no matter what. A lot of times we have prisoners. We don't know what they've done. I don't want to know. And I'm there to take care of them.
Yeah.
That's good.
I lost my train of thought. I had a question. That's not my role to have questions. I got lost in
role.
You guys talked
Keep
about
us on track. I'm just here to look
Yeah.
good and to make jokes. I'm doing my job really well.
You are. It's in your experience, that's where I was trying to go with it. I got my train of thought back. In your experience of having worked in the field, because you've both been in the field, your ability to then share those stories with students. What are some ways? Are even specific examples, if you have them, of being able to help a student kind of picture what this can look like, or student stories that you've had of how they've been able to impact lives because they're able to share more than just technically how can I heal you from this injury, but I can actually help you heal holistically.
Yeah.
Yeah.
I can see where
Go
yours is in the clinic.
Yeah, mine is in
Yeah.
the clinical setting. I can think of students I've been with in the clinical setting. One where the patient died, passed away, and of course the family. It was just such a hard time to say goodbye to a loved one. And the student prayed with the family. She made sure they had snacks and something to drink, and made sure they had everything that they needed while they grieved over their loved one. And so we encourage our students. We encourage them to go above and beyond and to care for all the needs, like you said, in the room. And we see that over and over again with our students. They care about the patients, and they go above and beyond to care for them or their family members. They'll all kinds of yeah.
And in radiography, they are seeing people in every situation. So they do not necessarily specialize. So they will see the entire lifespan, and they will have people come in from traumas in the ER. They will be rounding in the hospital with portable x-rays, and they are seeing them in brief moments of time, but very critical moments of time. And everyone knows that they have a chance to make a difference in someone's experience, but also their life in those brief moments that they have with them. And people are encouraged to do that. And they're actually measured on that in their clinical tools as well, their communication and how they are interacting with their patients. In the online world, we have a lot of journaling. And I think that journaling works very well. So when a RN is transitioning to a bachelor's degree, their classes are online. They now have context to apply to their situations, and they can journal about their experiences.
What, journal is part of the class, or is that part of the
part of the
work?
class.
It's part of the class.
Yeah.
Okay.
And so a lot of our journals they're private between the instructor, and they will share more about it. And we intentionally integrate spirituality throughout every course we have. All of our online courses have that threaded component that ties back to the major concept of the course. And that way, even if it's, reflect on this scripture and how it relates to this particular topic. And it's amazing what people will come out with. And I think it's a therapeutic for them as well, that they're able to look back and say, yes, I am the hands and feet of Jesus.
So that's fascinating. One of the things that is a question in my mind as you talk about this and the particular approach that we have to nursing healthcare as Christians, and yet you don't have to be a Christian to be in this program, right?
Right.
So what's that look like with people that come in men and women come here, maybe they don't have a faith background, they wouldn't consider themselves Christians, or maybe even just nominally Christian. And then this is the type of nursing we're teaching. What does that look like with a student who would say, I'm not a follower of Jesus? How can they do the journal? What's this look like? It's intriguing to me.
I have never had a problem, ever. And I have taught, I have no idea how many students, but I have never had an issue with them being able to take scripture and actually read it. And I've actually seen some pretty amazing transformations. I've seen people that were pretty far away in their relationship, and they drew closer, and they reflect on that at the end of the program. And we actually have them reflect on spirituality at the end of the program. And they talk about how their relationship improved, or they can still speak to it because they have been in a faith-based institution in their undergrad, in their ASN usually. And so there's prayer in the hospital every day. It's
at Mercy with the clinicals that we do.
Yes.
and
And we start our clinicals out with.
but I actually have never had an issue.
Yeah, me either. It's so we have servant leadership, and it's one of our outcomes on our clinical evaluation tools. So students reflect on that every semester of how they were able to serve their patients, and it's a love, respect, and grace, and service, and we've not ever had a problem with students serving their patients. Yeah.
Well, and we're not, you mentioned earlier, I mean, we call the podcast unapologetic. You mentioned that we're unapologetic as a university about where we stand on things. So students, I would hope, know coming in the approach that we're going to take. And so it's really, I think, a credit to the faculty and the outcomes of the program that they, even maybe not coming from that worldview, want to come in and still go through, knowing that they may not always feel comfortable potentially with the topics and things with it. The outcomes I did want to touch on, in particular, I mean, we have a long track record of not just students graduating, but 100% pass rates on NCLEX and other licensure exams, and great outcomes and relationships with local hospital systems and clinics. And so there's a reputation of the program that I think does draw students into. And so obviously you feel good about that, but how do you all sustain that? And, what are some of the keys to the fact that we do have such great outcomes?
Well, what are the outcomes? So I don't know that, I know that we want people to pass the NCLEX. I don't even know what that is. Here we say it all the time, and I'm like, I think that's great.
No, it's great.
It's a great thing, but I don't know what that is. So I'm sure people listening that are not in the nursing world are like, you're 100% pass rate on some exam. Why is that important? So what are the outcomes, and maybe explain a little bit of that. That would be maybe helpful for people listening.
Sure. The NCLEX is the National Council licensure exam. So it is ensuring the public that the nurse that is caring for you, if they have registered nurse, or they could be a licensed practical nurse, that they will take care of you in a safe and competent manner. So
that seems important.
Yeah. So it's an exam of safety. To show that they can make the critical decisions, decision making that they need to care for patients. Our BSN Bolivar program, we have first time 100% NCLEX pass rates for our 2024 data.
And 3 out of the last 4 years.
Yes.
Right.
And so very just excellent pass rates. Our ASN program, we're typically a little bit lower for our first time pass rate. So, but our ultimate pass rates have been 100%. So some students we get, and this is, they have children, they have full-time jobs, and they want to be a nurse. And so they have more obstacles to overcome to make sure they're ready. So sometimes it takes them a little bit more time, but they have such perseverance and grit that they're going to be excellent nurses.
So they go through the program at SBU, and although we can't guarantee you will pass, because that's a lot of that is dependent upon the student,
Yes.
right?
Yes.
There's a really good track record of we get you through and make sure that you're safe to go. And
Yes, yes. And if something were to happen and they don't pass the first time, we give them resources to help them be successful.
Right.
So, yeah.
So that's an outcome. We want people to pass that exam.
Yes.
Would you other bullet points you'd add to the outcomes?
Radiography has a registry exam, so they become a registered radiologic technologist. And they also, if you think about it, you're putting people through 4 or 5 semesters of school with heavy coursework. And then you're sending them to clinical at the same time while they're trying to manage work-life balance. Because
and
they're
not to be forgotten. I mean, these are not traditional
Correct.
college students who are living on campus coming out of high school.
Yes.
Right.
For the vast majority of the students you all are working with, they're adults transitioning
right.
to this as a career.
And then you're at the very end of all of that work, you have a test that's
One
going
test,
to
yeah.
determine whether or not you are going to practice right away. And I say right away, meaning first time pass rates are great, but they're not a measurement, like Renee said, of the whole person. Because if they pass on the second time, they still become a nurse or they still become a rad tech. So I have seen, I have to bring up our faculty because they're amazing. I have seen our faculty without any expectation of reward tutor students for hours to help them pass a registry for ASR, and I've seen them in nursing do the same. That is I think one of our distinctives. You'll hear it over and over. You will see it on surveys, everything. It is the faculty that have such a devotion to our students. You can see it in her eyes. Look at her. She's about to cry. But
That'd be the first time somebody's cried on the podcast.
That's probably going to be me.
but they really do. And we have a great culture here. We really do.
That's good.
I mean, one of the key things to transition a little bit out of just the program to some of the other partnerships and things we have in the region. I mean, another great marker of outcomes is we send you to jobs. And we have great partnerships and pipelines that we've created over years, with Mercy being, I don't think it's wrong to say, the biggest and closest partnership we have. So could you describe maybe some of what the Mercy partnership is in particular, and other ways that you all have developed these ways for students to get into the field?
Yeah, it's a beautiful partnership. The ASN nursing, we have with our new curriculum, it'll be 585 clinical hours. And the students really spend all their time at Mercy. They do go to the schools and to long-term care, but the other time is at Mercy, and it's in the intensive care units. It's on the med surg floors. It's in the emergency room, labor and delivery. It's in Mercy shares all their areas with us, the operating rooms. They have such a rich clinical experience that Mercy provides for us. It's wonderful. Yeah. And they have great resources. They have coordinators that help make sure that our students are having a good clinical experience, and the nurses partner with our students. They precept our students, and it's a really good partnership.
Same with radiography. We have clinic sites in Aurora, Bolivar, Branson, and then all of the Mercy main, they call it the main house, and then some outlying clinics that they get to experience, even the advanced modalities, which would be MRI, CT, ultrasound, and they get to see that piece of radiography, which has kind of an umbrella of imaging, is what it's called.
That's awesome.
And the need is great in the region. I mean,
Yes.
like every study that comes out, there's always a shortage of nurses or healthcare professionals in the region. So, I mean, we're not the only ones training, students. And I think we all do want to work well with all the other players. But one of those ways to meet those needs is partnering with other institutions too. So we've done that with Drury. We've done that with Michigan University. We've had other conversations with other universities in the area where they want their students who are interested in these fields to come take from us. They can help meet that need in the region. I mean, that's happened pretty quick the last 2 or 3 years. So
Yeah.
how has that process been, as you all have really started to, take on students from different areas? And I think the reputation of the university has kind of grown in the region as we're really stepping up to help more areas.
Yeah, we have to give credit to Brittany on that one. Our
definitely.
dean, she really has developed some very strong relationships with these partners. We also credit the leadership of the university at SBU
Absolutely.
for having the flexibility and being able to make it work, removing as many barriers as possible to allow the students to not feel anything and make it feel seamless between the partners. That's our biggest concern, is that we want the students taken care of and working together. And these people we've been partnering with have been wonderful.
Absolutely.
Yeah.
That's good.
And that we're in our first year. So in nursing, our students are in their second semester, and we're really enjoying them.
That's awesome.
Yeah, that's great.
Yeah, I mean, you mentioned Dr. Hendrickson. I mean, we also would be remiss to not mention Darren Crowder.
Oh, yes,
Oh,
he is.
fabulous.
One of our
Yes.
Yeah, he
cabinet
gets
members.
really upset when he watches if we don't mention him.
We
So
cannot
Darren,
leave out
there
Darren.
you go. We mentioned you. You're important.
Yep, and Dr. Manley, our provost,
Yes.
because these really do take pretty detailed,
Yes.
long-term conversations
Yes.
to iron out the details. To where,
Absolutely.
I know Darren's been working with Robbie Bryant.
Oh,
Yes.
yeah.
To do some things there. So they've been down here quite a bit working on
And
this.
Darren's been in on all of these partnerships from the get-go.
Uh-huh.
So from the very beginning, it's been, without that support at that level, we couldn't have done it.
Absolutely.
and there are, more changes coming in Springfield and the campus and things that are happening.
Are there?
So
Are
yeah, it's,
Can we talk about
yeah,
it?
we can. It's out there. So
Yeah.
the Doctor of Physical Therapy program will be coming and
Excited.
operating out of this building. And
Well, that was what I was meaning. That's kind of the build out that Robbie and his
Right.
team are thinking through.
Mhm.
so that brings in some, changes to the physical campus and
Yep.
more activity on campus, which I think is exciting.
We
But
love it.
as you look to that potentially, or just other things that are maybe, coming, what are some things that you're really excited about over the next, year or two that are okay?
Interprofessional education, where they learn together.
Yeah.
They can learn in simulation together, where it makes it feel like a real hospital.
Yeah.
Everybody's bumping into each other. Everybody's working, learning how to speak the same language. And hopefully the outcome is that when everybody goes out into the workforce, they have some faces they recognize.
That's
You
cool.
get some civility with
Yeah.
everybody across disciplines, and everybody works as a team for the patient.
That's great.
Yeah. Today we have.
Yeah, they're here today.
They're here today. PT is
Yeah.
working with
PT
nursing
here
today
Dr.
on
Cox
a
on
simulation.
campus.
Yep.
Yesterday we had our social work.
Social work.
Yeah,
Yep.
students here also in simulation. We would like to expand. that.
Yep, we're going to get
Yes.
radiography and then
Yes.
hopefully pharmacy.
And
Yeah.
and develop it throughout the curriculum for all the programs. Yeah.
That's awesome.
Yeah.
That's awesome.
Yes, we're not sitting idle. by
No.
any means.
Yeah,
We're-
yeah.
We're working through it.
Is there a wait list for the nursing programs now? At one point, was there? I don't know.
There has been in the past, and we're looking like there could be
Yeah.
in radiography.
Okay.
Yep.
So if you're wanting to get into the program, apply now.
Yeah.
Get your spot.
Yeah.
Yeah, and the delivery has sort of changed. I mean, there are more entry points and on-ramps for some of these things, not ASR
Yeah.
necessarily,
It's
Yeah.
once a year.
but the nursing programs,
Oh,
we
yeah.
have other ways that students can come in. We do pre-nursing, we do
Yes.
ASN, RN to BSN.
Mhm.
Yeah, ASN, we have our bridge, so LPN or paramedic to ASN, and we admit every fall and spring in the ASN, summer for the bridge. So, which a lot of programs just admit once a year, so we admit 3 times a year, really. So it's good. Yeah.
Well, thank you both for all the hard work
Yeah.
you all are doing. And
If this doesn't work out, our podcast thing, I may have to become a nurse.
Oh, that'd be great. That'd be
Yeah.
I think it'd be awesome.
another career switch. Yeah.
Oh, also,
You would have great
Rick-
bedside manner.
You really would.
great.
They would like it.
I mean, as when I was a pastor for 15 years or so before I went back into higher ed, I don't want to say hospital visits were fun, right? They're not
Right.
fun, but life-giving.
Right.
The opportunity to be with families in a very different way. I wasn't there. I always often thought, though, man, I could prescribe some medicine. But to be there to encourage people,
Yes.
to be with people in hard moments it's a life-giving thing, a gift
Yeah.
to be able to be there. So, do we do radiography in house here? Because my foot's killing me.
He'd probably get in trouble if he shot an X-ray of you.
Okay, well, I tried. My wife said I need to go get an X-ray.
We do have an actual lab back
Yeah,
there
that's
that's
right.
radiated.
Well, we'll get Dr. Cox, the chair of our physical therapy program.
Yeah.
Yeah, that'd be
We'll
great.
grab him and have him give you a
Beautiful.
couple of exercises.
Yeah.
That's good.
You have to do the work,
What work?
stretching.
I don't want to do that. Just fix it.
You just want to feel
He wants a
Yeah.
quick fix.
good bedside manner, maybe not a good patient.
Yes.
That's fair.
Well, thank you all both. I
Yeah,
was looking
thank
forward to
you.
this one to chat more, and I'm sure there'll be lots more opportunities, especially as PT starts moving in,
Yes.
to kind of check back and see
Yeah,
how
that'd be
things are
great.
going here.
Yeah, thanks.
Right. Well, thank you for listening, everybody, and we'll be back next week with the next episode. Take care.